So I'm here with Richard Horton. He's the editor-in-chief of the Lancet, which is a premier medical journal based in Britain, but its reach is global. You also have a book out, the COVID-19 Catastrophe. And as you say in the prologue to that, this is an angry book. In the sense that where you're angry. And so it has a righteous anger to it about the global response. You have a lot of tough things to say, but I think very important things to say. So we wanted to hear those. How do you think the Chinese response was in those early days, both for Wuhan and for the greater world?
Well, the very first patient that is reported that we've published about was the 1st of December, was admitted on the 1st of December. So the initial contact with the World Health Organization, or at least the public release of information by the Chinese authorities that was picked up by the World Health Organization, was on December the 31st. So there was a month between the first patient with this mysterious pneumonia and the time when the Wuhan authorities made a declaration that there was an outbreak. We need to know more about what happened during that month. But if you compare that time with what happened in 2002, 2003, when the Chinese authorities actually said there was no outbreak, and to be very frank, tried to deceive the world 20 years ago, until the World Health Organization called them out on it, I think China learned the lesson that you can't sit on this kind of information for very long.
I don't think there's been any time in humankind where science has been this fast. Am I wrong?
I've never seen anything like it in my life. And I've been at the Lancet 30 years. And I think, you described the book as angry. I was angry, yes. In the early days, and still am to an extent, but I hope the book's not fully angry, because what I'm trying to do is to also look at the incredible opportunity that this pandemic has shown for rewriting a story for the way we work together. I mean, before this pandemic, the research community didn't work as fast or as efficiently on urgent problems like it has done in the past 6 months. I mean, it is phenomenal to go from discovery of a new virus to candidate vaccines in 6 months. That's never happened before.
Would you say that the response by the research community has been far better by the response of governments?
Yes, and that's one of the reasons why I did get angry. And so there was this terrible disconnect between the stories that we were publishing in research papers and the fact that that work was falling on deaf ears. In fact, to be fair, when I first heard about the outbreak in early January, I didn't think that this was going to be as serious as it was. It was only when I read the papers that we were publishing.
Your critique and many people's critique is that the government's acted slowly. These gaps, these delays are within days to weeks. I mean, governments usually operate in months. Was it slow, or was it, like the science for a government, pretty fast? I remember March, my head was spinning because I didn't remember, are we worried about this, or should we start digging the bunker?
Well, in medical terms, it was slow. I mean, if you've got an acute medical emergency, and this was an acute public health emergency, where the virus is literally growing exponentially in your population, so that it's doubling every 3 days or so, then you don't have a week to make up your mind. Let's think about how you would respond. The World Health Organization declares a public health emergency of international concern on January the 30th. You would imagine that the Foreign Office or the Prime Minister's office or the Minister of Health would ask its embassy in Beijing to give them within 24 hours an immediate report of what was taking place in the country. They would have had a one-page summary explaining SARS virus, tipping people into hospital, no treatment, no vaccine, many people dying, mysterious illness, prediction of a global pandemic. So that's sitting on the Prime Minister's office desk on February the 1st. Now, you see that, you would think that you would say, okay, what are the levers I need to now be pulling? I need to be getting test, trace, and isolate systems in place. Have we got personal protective equipment in place? Incidentally, all of this is described in the Lancet papers, so there's no excuse for not knowing that. How are we going to think about physical distancing to cut the lines of transmission? What's our policy on schools? How are we going to stop mass gatherings from transmitting this virus? All of that should have been discussed literally within 48, 72 hours after the fake was declared. And then there should have been a strategy. The scientists here didn't take the science coming out of China seriously. And I think that this is a very interesting area to reflect upon.
Because I agree with you, and it was really when it became a European problem in
exactly
that it slapped them on the face.
I think that we have every reason to be optimistic that by the end of this year, we will have identified a vaccine, at least one vaccine, that has some measure of effectiveness and is safe. Now, but hang on, I want to just temper that, because it's really important to get this message clear. A vaccine is not going to be a magic bullet. A vaccine is not going to take this virus out of our society. A vaccine is never 100% effective, 100% safe, and will be available to 100% of people. We're not going to get a vaccine to 7 billion people on the planet. And 7 billion people on the planet aren't going to want to take it. So we're still going to have to think about the things that we're doing now. We're still going to have to be doing some of those in the future. We know the people who should be receiving the vaccine, and we need to come up with a global solution so that those people who live in countries that are not as rich as the United States or the United Kingdom also have the opportunity to get access to a vaccine. So this risk of vaccine nationalism is very real, and it shouldn't be the strongest or the richest country that gets access to a vaccine first. We need a fair way of distributing the vaccine.